Hi viewers, welcome to our channel. Presently, we are along with Dr. Madhav ma'am, endocrinologist, Apollo Hospital. Ma'am, hello ma'am, how are you?
Oh, fine. Thank you.
Ma'am, first of all, thank you so much for your valuable time with us.
Thank you.
And ma'am, my question is, what is diabetes, ma'am?
So that's a very pertinent question. What is diabetes? Diabetes, by definition, is a state where the person will have higher than normal blood glucose levels. So it
Okay.
can be because of many reasons, but ultimate thing is more than normal levels of blood glucose in a person. We call it a state of diabetes.
Okay. Ma'am, how to control diabetes with healthy diet, ma'am?
So there are some conditions of diabetes which can be very well controlled with healthy diet. Diabetes, majority of the diabetes cases that we see are lifestyle diseases, wherein the diabetes is majorly because of poor lifestyle choices with
Okay.
increased carbohydrate, increased fat content, and low protein, low exercise.
Okay.
So, when we try to balance all these things by consuming a moderate amount of carbohydrates, few calories can comprise of saturated fats, and increase protein in the diet.
Okay.
And by this we mean a balanced diet. Along with balanced diet, if we add physical activity also,
Okay.
so majority of the diabetes, especially the type 2 diabetes, which is mostly because of this lifestyle modification changes, that can be controlled with a diet. Sometimes we may not be able to do with diet alone, wherein the specialist can add some medication, start from a lower medications, and titrate it based upon the need of the patient.
Okay. Ma'am, what is type 1 diabetes?
So, yes, this is where the difference in treatment comes. Type 1 diabetes is basically it's actually a deficiency of a hormone called insulin.
Okay.
So mostly it occurs in children, but it can occur at any age, but most of the times we see in children.
Okay.
So what happens is the pancreas, for any number of reasons, it stops functioning and the insulin production is halted. So there is no insulin secretion.
Okay.
So why we need insulin as a hormone is it helps us utilize the glucose that is there in the blood.
Okay.
So all the cells, all the organs, muscles, everything, they need this hormone which will let the glucose from the bloodstream to enter the cell and the cell will utilize.
Okay.
So in effect what happens is because of this insulin deficiency, the glucose is very high in the bloodstream that we measure,
Okay.
and none of the organs are getting the glucose. So we are having cells deprived of their energy, whereas the blood is very high in glucose.
Okay.
And this high glucose will have its own set of complications.
Okay.
So in a nutshell, this is what type 1 diabetes is: basically all the results that come from insulin deficiency.
Okay. Ma'am, what is type 2 diabetes?
So type 2 diabetes also, again, as per definition, all diabetes is increased levels of blood glucose in the person. So type 1 diabetes, like we saw, is the deficiency of insulin. In type 2 diabetes, what happens is there is some amount of secretion of insulin,
Okay.
but it is still less than what the person requires.
Okay.
So that is one aspect of the disease. And a more prominent aspect of the disease is whatever insulin that is being produced, it is not being able to utilize by the cells.
Okay.
So in effect, we call it insulin resistance. The cells become resistant to that insulin.
Okay.
It can be differential resistance. Some cells respond more, some cells respond less. But overall, what we have is, along with a little bit of deficiency, the resistance is there. The insulin that is there also is not able to act.
Okay.
And again, as a result of that, we have a higher blood glucose, and the high blood glucose over time will lead to complications.
Okay. Ma'am, how do diabetes affect on kidneys?
So this one of the important complications that can happen because of uncontrolled diabetes is kidney disease, and end stage kidney disease, what we call. It is most common cause of that stage, end stage kidney disease is in fact type 2 diabetes, which is uncontrolled, and type 1 diabetes also, they have kidney problems. So what happens is, if it is well controlled, we
Okay.
can really postpone that complication for a long time. Many of the patients, more than 50-60% of people, may not even have experienced that complication if they are well controlled. So
Okay.
it can happen in about 40% of population, and what we can do to prevent is more important here. So in any patient who is having chronic type 2 diabetes or type 1 diabetes, what we can do is control their blood pressure very well. So good,
Okay.
strict control of blood pressure, control of blood glucose. So in the long run, this is all we will have to do.
Okay.
Good glycemic, good control of glucose and good blood pressure control will eventually postpone this complication for a long time. And again, a healthy diet, like how we started, with less salt and good protein, good exercise, they all also play a role. But majorly controlling the other inciting agents,
Okay.
thereby we can postpone the complications. But if we leave it uncontrolled, then there is a very big chance of getting complications in all organs, including the kidneys.
Okay. Ma'am, how do diabetes affect on pregnancy women?
Diabetes in pregnancy, again, we have two things here what we need to understand. One is, a previously non-diabetic woman gets pregnant and is diagnosed with diabetes after getting pregnant. So this
Okay.
is what we call gestational diabetes. This occurs because of some hormonal changes that occur during pregnancy.
Okay.
So most often this starts at around 5th month of pregnancy, after the 5th month of pregnancy. So until then, the hormones changes are not so significant as to cause a diabetes stage.
Okay.
After that, for various adaptations, because of the development of fetus, there will be some hormonal changes. Some women will be able to adapt to the changes, some women may not be able to.
Yeah.
So there they will get diabetes. So that is one aspect. The other aspect is, a previously diabetic person becomes pregnant.
Okay.
So they start pregnancy while they are diabetic. So
Okay.
there is some minor differences in the treatment and all, but majorly what is important is, control of glucose should be very strict in pregnant women.
Okay.
Whether they are gestational, that is, they are diagnosed after the pregnancy, or they have been diabetic before pregnancy. What is very important is, the values are not as relaxed as what is there in non-pregnant people.
Okay.
Because we have only 9-month period, the baby has to develop properly. So the goals are much stricter here.
Okay.
And we should also not let the mother go into low sugars.
Okay.
So that again, because the baby is completely dependent upon mother for sugars throughout pregnancy.
Okay.
So we need to have very close monitoring, good tight control. Otherwise, there can be some complications like premature delivery. The babies can be heavyweight. There can be more like
other complications.
And some complications for the baby, some complications for the mother.
Okay.
Like increased infections and all. That itself we can talk a lot, but basic gist of it is, the mother should be well educated. She should be in good communication with the diabetes team.
Okay.
There should be good monitoring. They should know how to check, how to change their insulin values, whether if they are on insulin.
Okay.
And we should have it's a team approach. A dietitian, a nutritionist,
Okay.
and physical activity, the endocrinologist, the mother, all of them together, they should get through that pregnancy.
Okay. Ma'am, what is diabetic foot?
So diabetic foot is a complication of diabetes, one of the dreaded complications, like we can say, because saving the foot is one of the important goals that we have when there is diabetic foot. So diabetic foot happens because of neurological issues associated with circulation issues.
Okay.
So there is nerve damage on one side and there is circulation damages on one side.
Okay.
So because of the nerve damage, what happens, even if the foot is getting hurt, the person will not be aware of it. They will not know that there is something is pricking, something is hurting the foot. So that small minor traumas, they will go unnoticed, and repeatedly if it gets hurt, it will form an ulcer, and they may
Okay.
still not be aware of it until they look at it.
Okay.
So this is the nerve part of it. And then because there is an ulcer, we expect it to heal like any other thing.
Yeah.
But the healing also is compromised because the circulation is compromised.
Okay.
So on the one hand, nerve damage is there, which is causing this person to not pay attention to the hurt. And on the other hand, the circulation is compromised, so the healing is not happening as it should.
Okay.
So this is basic gist of diabetic foot. So if it keeps happening and sometimes the circulation is so bad, it can endanger the limb of that person.
Okay.
And in rare cases where there is very high rate of infection, it can be life endangering also.
Okay.
So the reason why we have to pay attention is we can prevent it.
Okay.
So the person can be taught to check their legs every day because the other clues are not there. He's
Okay.
not feeling the pain. So the only
Okay.
other way is to check the foot every day. If they are able to check it themselves, then otherwise we can educate the family members.
Okay.
So they should check their feet every day,
Hmm.
and the doctor should check at every visit.
Okay.
So this is physical checking. And we also have some tests which we can do where we can see the sensitivity of the person to touch and vibration, and we can basically assess whether the person's foot is at risk for this ulcer or no.
Yes.
So it is important because when we know that it is at risk, we can
Okay.
tell them how to prevent it. We can see
Okay.
where the friction points are and give footwear according to it. We can
Okay.
tell them what activities we can avoid.
Hmm.
So that is an important part. It's always prevention what
Okay.
takes the front seat when it comes to these kinds of complications.
Okay. Ma'am, most commonly we see like what kind of fruits diabetic patients should have. Like there are a lot of fruits. So every day, like everybody, if we look at an apple a day, it keeps doctor away.
Yes.
So what do you suggest for diabetic patients?
See, this is really very, very common question. What we can think of is diabetes diet should not be drastically different from a healthy diet.
Okay.
Everybody should be following the same healthy, balanced diet.
Okay.
So we should not really make it a marginalized population. We all should be eating that same thing. Fruits are very healthy. Fruits can be consumed except for in very, very uncontrolled sugars. Again, portion control is what matters.
Okay.
So if we have one apple, it will probably give us 60 calories. There is nothing wrong with that. We can
Okay.
have. We can fix a time for a snack. The
Okay.
snack should be fruit.
Okay.
But unfortunately for us, snack is never a fruit. Fruit is considered as one
Yes.
only for sick people.
Sick people, yes.
It's not a snack. So we can consume all kinds of fruits,
Okay.
but portion control for some fruits. Very high sugar content, what we call glycemic index.
Okay.
Suppose there is a mango, it's very sweet.
Okay.
Maybe you can allow 1 or 2 pieces.
Okay.
So depending upon that person. So again, individualizing is all,
Yes.
every time it should be individualized.
Yeah.
So if their control is very good, they are lean, you can allow a little more portions. If they are already not well controlled, we'll restrict some kinds of fruits. But by far, all the seasonal fruits should be taken. They are all healthy. Apple, pomegranate, papaya, everything can be taken. Guava. Sometimes we restrict some fruits if they are very uncontrolled.
Okay.
And one thing that people should remember is, if we want more fiber, we should eat raw. Suppose guava is there. If you eat raw guava, we get more fiber,
Okay.
less calories. If you let it ripen, the process of ripening is all that fiber is getting digested.
Better digested, yes.
So it becomes ripe. So the fiber content goes down, the sugar content goes up.
Okay.
So that also, if we explain to people, they will be able to make a choice.
Yes, exactly.
Depending upon their sugars and all.
Yeah, they will have it.
They can have it, but not very sweet ones.
Yeah.
And whatever seasonal fruits are there, citrus fruits are not very high in calories.
Okay.
Apple is not very high in calories. They all have around 60-80 calories.
Okay.
So, and portion control, we can sit and discuss with a nutritionist about how much is allowed for them.
Okay.
A small cup is usually good enough with all the seasonal fruits.
Okay.
Again, why I'm stressing seasonal fruits is the ease of getting the fruit. Not that fruit should not be an expensive option.
Okay.
It is a very healthy thing. Whatever calories get, we get so much more nutrients in return. It's not like some samosa or something where we get only calories.
Yes.
We do get calories, but we get enough good nutrients, and that calories are also in very moderate amounts.
Yeah.
So we should be able to teach our people how each fruit can be taken. Seasonal fruits
Yeah.
are less expensive, they are equally good, and we are born and brought up with that fruit, so we are usually well tolerating of those fruits.
Okay. Ma'am, nowadays, if we see a lot of small babies, like, by birth only we can see diabetes. So it's a very bad situation. And so, like, how we can see this one? Like,
So diabetes in children, there is different classes. What we see at birth or shortly after birth within 6 months
okay.
is usually genetic, monogenic.
Hmm.
That incidence has not really gone up as much. We are probably detecting a little bit more number of cases because of increased awareness in the parents and all. But that is
Okay.
a genetic cause. Within the first 6 months to 1 year also, it is not usually the diabetes that we see in adults.
Okay.
And then when it comes to childhood, it is that type 1 diabetes that we were talking about. Because of many viral infections and immune causes, there are so many ways where it can happen. The pancreas stops secreting insulin,
Okay.
and the child becomes diabetic. That is usually type 1 diabetes.
Okay.
What is more alarming and what we are seeing recently is young children coming with type 2 diabetes.
Okay.
So what we see is around even as young as 8 to 9 years old children, they come with sugars of 250, 300 values, and they are not type 1 diabetes. They are getting this as a type 2 diabetes, meaning it is what we would expect in an older person, adult patients.
Okay.
So because of the increasing obesity in children, they are having obesity where BMIs are reaching 35, 32 and high values.
Yeah.
So there they are going into the adult diabetes pathology, and we are seeing type 2 diabetes in young children also. That is very alarming.
Okay.
And again, we have to really focus on lifestyle changes of the whole family, not just the child.
Okay.
The child will never respond if it is separated from the family and talked to.
Yes.
The whole family has to adapt to the situation. They should stop getting any kind of unnecessary junk food. The food choices should change in the whole family as such. And there are
Yes.
some psychological factors also. There is some reason why the child is overeating. It doesn't happen just like that.
Yes.
So the reasons why the child is overeating, very rarely they are genetic and medical. That the doctors will deal with. That the parents cannot deal with. But there are sometimes psychological causes why the child is overeating. Frequent disturbances in the family, some kind of dynamic changes that are going on that the child is not able to adapt to.
Okay.
There we have to treat it as a obesity also.
Okay.
So we cannot concentrate only on the diabetes part. The reason why the child is diabetic is because the child is obese.
Yes.
So why the child is obese, there will be some reason which we might be able to target.
Yes, ma'am.
So if it's a psychological thing, we should have a team. Usually the obesity teams, they have at least a clinical psychologist who can find and talk to the child.
Okay.
It's not easy for the consultant to sit and talk because the child will not open up sometimes in the first visit. We might
Yes.
need 2 or 3 visits, and the endocrinologist may not be fully equipped to deal with the psychological issues also. So it's always better to have one psychologist also on the team, and it should again be a team approach.
Okay.
So the genetic causes, type 1 causes are one side. The increasing epidemic of obesity and increasing type 2 diabetes in children is what is the more alarming thing, and that is where we can actually make some change.
Okay.
Genetic things we may not be able
Yes.
to do much. This is where we can help the children and the whole family as such.
Yeah. Thank you so much, ma'am, for your valuable time. And so, viewers, this is all for today. And next week, we'll be meeting with some other topic. Thank you so much. This is Prithikesh signing off.
Thank you for having me.